Greetings from Durham, North Carolina. Welcome to the first Wish Revolution Conversation series. Today we'll be discussing how COVID-19 is impacting the care services. We have with us Dr. Patty Garcia, a renowned leader in global health and professor of public health at Cayetano University. Dr. Garcia has also served as Health Minister of Peru. Welcome, Dr. Garcia.
Hello.
We also have another renowned leader of global health, Dr. Nimmi Ramanujam, a professor of biomedical engineering at Duke University and director of the Center for Global Women's Health Technologies. Welcome, Dr. Ramanujam.
Nice to see you, Nabil. So today I'd like to just say that I'm very excited that we're able to start the WISH series, which really focuses on how COVID-19 is impacting healthcare. And there's probably no better person to start the series than Dr. Garcia. She and I have been working for several years together on an initiative called the WISH Revolution, and WISH stands for Women Inspired Strategies for Health. And through this initiative, we are both trying to avert the trajectory of the rising incidence of cervical cancer through a women-centered model. So today, I would like to talk to Patty as a former health minister and a public health specialist, what her experiences are with COVID-19. And so Patty, welcome to the WISH series. And I'd like to start off with a question. As a Peruvian citizen and a global citizen, what has your experience been like with COVID-19?
Well, thank you so much for having me here. We are, as the rest of the world, we're suffering with this new situation, with this new virus that is just 3.5 months old. It has been hard, and what we are learning is how much we need to change, and we are learning about our vulnerability as humans. This is something that is evolving. I mean, everybody knows how we're suffering. In Peru and in the whole Latin America, we have additional challenges. We have health systems that are completely, that are weak. We have health systems that are not integrated. Our capacities to respond to the most severe cases in intensive care units are very poor, but we also have issues of access, problems with laboratories because, I mean, we don't have the capacity for molecular testing. We have also access issues because we have rural areas where people are very difficult to reach. We have the issue of migration in Latin America lately that had been worsened because of the movements of people from Venezuela, which already was bringing an extra problem to the health systems. Like in Peru, we have about 1.5 million Venezuelans. And so this is a real challenge for public health. And I think we are all trying to learn how to address it. And especially another big challenge is how to address this issue without leaving out all the other issues that we have been already trying to dealing with in the health area. So issues like chronic diseases, because we were used in this part of the world, we were very used to work on infectious diseases, but we were forgetting chronic diseases, and issues like cancer, and specifically one cancer that we have been working together, cervical cancer. So these are difficult times, and we know that this is not going to end pretty soon. We hope to gain some time trying to flatten the curve of the cases while science works on new drugs and hopefully a vaccine, but that may take some time.
So it sounds like things are really challenging, both in Peru and globally. And I remember actually when you were here in March, and we were not even realizing how severe the situation was. I think this was in early March. And then literally after your visit to Durham, North Carolina, you went back, and then Peru was in lockdown, and everybody in the USA, or at least in Durham, North Carolina, were supposed to essentially stay home. So it happened really quickly. So everything has been sort of fast-paced at this time. So what are you doing in terms of policy, or in terms of thinking through what the future looks like generally for COVID-19 and the broader healthcare issues in Peru and globally?
Yeah. So actually, I was in North Carolina the first week of March, and it was on the 5th that you have just few cases in the U.S., and on the 6th, that was the day that I was supposed to leave, that the first case of COVID-19 was reported in Peru. Few days before, actually on February the 29th, in Brazil, we had the first case in Latin America. And from there, very rapidly, things evolved, okay? The next week, one of the things that happened here in the government is that the president and the whole team realized that it was going to be difficult to really handle such a situation in a country like mine. And so pretty soon, 4 or 5 days after the first case, they released this norm to close schools. But it was incredible, because the next day schools were still open, because people, I mean, they didn't realize, although there was this norm about closing schools were not closed. So talking with the president, he had to take more strict measures. And in 2 days, we had a complete lockdown. So at that point, I was asked to help advising for public health issues related to COVID, from issues related to diagnostics, since I have been working on point-of-care diagnostics, for example, and molecular diagnostics, like the ones that we're working with cervical cancer. From there, all the way into how can we organize, I mean, are there any drugs? Can we do something? And actually, since I'm also at the global level a member of the Coalition for Emergency Preparedness Innovations, which is CEPI, which has to do with vaccines for new epidemics. Okay, this is a global organization. So I was able also to link the country to what is being done at a much higher level. So I started organizing the linkages for Peru to participate in this randomized controlled trial of the most promising drugs that might be happening for the treatment of COVID, which is called the Solidarity randomized trial with WHO. So I started advising on what to do about diagnostics, participation on this randomized trial, and reviewing processes and helping on decisions, and looking at the measures, and also on social communication, which I was doing previously. I mean, just because sometimes the media calls me, and I try to make it simple for people to understand. And so that has kept me busy. I work directly with the Minister of Health, with the Vice Minister of Public Health. And actually, we have been following day by day what is going on. The president has taken the leadership. And with these very strict measures, we even had to make it stricter. We had to start a curfew at the country, because it has been so difficult. I don't know how it is in the US, but it has been so difficult to make people understand, number one, what this virus means. The second thing is how effective it is, what are the risks. And so it has been already, I think we are in the 5th, going into the 6th week of completely lockdown. People now knows that if they go out, they can go out ideally, only one person in the family, ideally only once or twice a week with the masks, the washing the hands, the alcohol gel, but still you see, especially in the markets, that you may see lots of people together. So we are day by day, we're trying to discuss what could be the other measures that should work. And now our concern after 5 weeks or 5 weeks and a half of lockdown is, because part of the lockdown is also closing health centers and just serving for emergencies. But the fact that we have COVID doesn't stop other diseases. So now we are discussing, I mean, how are we going to move along with health services? How should these health services transform into a different type of service? And I think that's when we started to think how important it is to have technologies, to have communications, to use telemedicine. And that's part of the transformation that we need to start thinking about in our health system, because this issue about COVID is not going to stop here. We know that if the lockdown, we're evaluating if the lockdown will be stopped in a couple of weeks, but if it does, normality is not going to be as we were used to. And so we will need to continue telework, probably, teleeducation, maybe. And so we will need to start thinking about telemedicine more seriously. And I think in that sense, and linking to what we are doing, I think what we have been thinking about new technologies where women in the comfort of their house can have a self-collection to test them for cervical cancer. And if the results are abnormal, she could do her own view of her cervix, and using technology, a provider at the health center could see the image. I mean, that's perfect for this new post-COVID era, or maybe COVID era, in which we will need to have less people interacting to each other because we have to promote this social distancing. So we are in that process of thinking about that. And I'm also we just organized a new committee that is an advising committee for the Minister of Health, which is called the Committee for Innovations for Health for the Pandemic, okay, for the COVID pandemic. And actually, we have 16 people as part of this, okay? And we have from molecular biologists to biophysicists to biomedical engineers. We have informatics, we have immunologists, okay? And we have divided this group. We just started with this in small groups that are going to be talking about how can we work on biotechnology? How can we work about new models to give self-services? What about new ways of doing biosecurity for the health providers, informatics, etc. So we are evolving with this epidemic. In Peru, we have been able to, as I said, to shut down the curve, but that means that we have so many people that are vulnerable. We have been able to push testing. We have more than 120,000 people tested with molecular plus serologic tests, okay? And we have about 12,000 people infected and about 271 deaths, okay? But that's the result of measures, extreme measures that were taken very early. But our economy is suffering. So we have to think about new ways in which we're gonna be living to try to keep the numbers down, but also to start moving along.
Wow, there were so many important points there that you made. I have to say that, just personally, I'm now watching my husband do telehealth, and they never did that before, at least to my knowledge here. And there were some growing pains, but now he says, wow, it's so efficient, and people don't have to travel so far for a 15 or 30-minute appointment. So much can be done through this face-to-face like we are doing. But it's in some ways, it's really sad that we're facing this pandemic, but maybe there's a silver lining that the future
Yes.
of healthcare could be transformed in a way that benefits so many more people. So you also mentioned that, you know, this pandemic is really affecting people in the rural community, people that don't already have access to care. But let me now contextualize that within cervical cancer. We know cervical cancer is a virus. We know there's a vaccine. We know that there are preventative measures. You see, there's so many parallels in some way with COVID-19. Do you think that this issue with COVID-19, it can both create fear, right, in seeking
Yeah.
healthcare because you're acutely focused on this issue, but it will also sensitize people to thinking about viral diseases and how scary they can be, even if they're not acute like COVID-19 in creating some sort of illness. So I just want you to talk about that paradox. On the one hand, people might be terrified and not want to go to the health provider because they might be afraid of getting infected, even, you know, next year if there's no vaccine. And on the other hand, this could be a great opportunity to let people know, look, viruses can affect on different timelines, but you have to take care of yourself or the consequences can be severe.
Yeah, I completely agree with you that we need to see we need to see the good on this terrible situation, okay? And I probably will try to see what are the goods. So number one is we're realizing that we can do things through internet, okay? And so in Peru, for example, we are already through the government, there is a lot of tele-education. And the tele-education is not being done only through computers. I mean, it's being done through the television and in some areas that are far away, even the radio, local radios, okay? So there are different ways in which we can communicate, and we're trying to expand that communication. So that's really good, okay? The second thing, as you said, is to realize that there are viruses. So the word virus is already in the head of the people, and that they can be deadly, and that you need to think about yourself. We are realizing what public health is, okay? And public health is not only what the government does, but what the people does. Because in this situation is the government can say, stay home, but if you don't, or you don't wash your hands or use your mask, etc., you're gonna get sick. So that's another thing that is important. People are starting to understand testing, okay? So this is kind of like really telling people what molecular tests are, what serologic tests are. So for the molecular test, I think this is great, because then when we were talking about cervical cancer, we talk about molecular testing for cervical cancer. So people will understand that much better. So, and in the health sector, as you said, providers, I don't know in the US, but here in Peru, they have been always like very against telemedicine in a way, because they feel that they are breaking the relationship between people, etc. But now providers are also scared about their own health and risks, right? So it's not only that we're locked down, but also, wow, how can I decrease my risk? I mean, there might be situations in which I have to see and touch a patient, but there are lots in which I just need to talk. So I think this should help us to become more efficient, okay? But having said that, we are realizing also that still the most vulnerable people, okay, are the ones that are going to be hit later with this disease, and are the ones that we need to focus on for any type of response or help on the other types of health. So we're seeing that it's still difficult to bring them the message, to let them understand what's going on, but it's also good that we are realizing that there are pockets, okay, within the country, the same pockets that we were talking about, Nimmi, on how to reach with these technologies. So the same pockets, how can we talk with the population in the rural Andean region and explain them about this virus, okay, and the risk that they have, especially when, if they are in their communities far away, there's no problem. But part of the culture is to come down at least one every 15 days to this Sunday feria that is like a big market, and that's when they are going to get infected, right? So how do we talk with them? How do we explain them that? So those are the kind of things that we were thinking to use in order to bring them the messages about cervical cancer and the technology, etc. So now that the whole system is thinking about that, I think that's also the advantage, to have better ways of bringing health in general, not only COVID, to these communities. So yeah, you use that word in English, is silver lining. That's how you say it?
Silver lining, yeah. There's a
Silver
silver
lining.
lining.
Yeah.
And
So I don't think we have a word like that in Spanish. Okay, but it's a true opportunity. Okay. So in the middle, I mean, we have to see, if we only see the dark thing in this COVID, we're going to get depressed, and then we will have an additional problem, mental health, right? So I think we have to see that there is an opportunity, and the opportunity is given by this emergency that is opening the eyes of everybody, that technology can help, that we need to reach the ones that before we thought that were unreachable, and we can do it through technology, and that's key.
wow. And you know, it's interesting because the things you said really point to one thing. We are all connected. And
Absolutely.
one person's health can directly impact another person's health, regardless of your socioeconomic status.
And that's public health.
That's public health. This exemplifies this. And so I'm so excited that there's this possibility of really moving healthcare to a new paradigm. Do you think that, I think you alluded to this, do you think that maybe in the future, as we talk about the WISH revolution and the technologies we're developing for, you know, self-testing and community-based testing and treatment, do you see that in part being integrated with the new channels that are being created both for education and healthcare delivery? Because we all know when you can package healthcare together or healthcare delivery services together, it's actually more economical than if you do, you know, one at a time. And so if the channel is created, it seems like, you know, you could do multiple tests at the same time, or offer multiple tests through the same channel. So what are your thoughts about that? Is that sort of too hard to think about, or is that, do you see that being a reality in the future? Integration of health services.
Well, I think this epidemic is making us starting to talk about it. So I think yes. I mean, we're starting to talk about this integration and doing it all together. So I think there is an opportunity again. We're starting to see things differently. You know that even in the economic side of the problem, people are starting to realize how important it is to invest in health for the very first time. I mean, it's like the testing. So it's not only education. Remember that we're talking about teleeducation, we're talking about telework, right? And we're talking about telehealth. So we're starting to think about all together, but also the integration of health, maybe in the messages for education, right? But also the integration of health as a very important component in work or in the economic strategies, because if people are not healthy I mean, I have been saying this for a long time, and I have been saying, like, you know, when you use money or you put money for health, you are not spending the money, you are investing the money, right? But I don't think it was not going into there. But now even the companies that want to reopen, they are saying, like, how can I do an investment so my workers are going to be healthy? Okay. And so I think and I hope this lasts. I think this is the moment in which this is a strategic moment, because we need to get all these things that are happening and grab them so they will stay even when COVID disappears. Okay. So the kind of things in which we're thinking that health is an investment, that technology can help, and the same thing that is happening with COVID, can happen with the other viruses like cervical cancer, except that you're not seeing it at this moment because it takes some time, but it's also killing the people that works with you, women that are working with you, families, is affecting families. And there are things that you can do, and we have a vaccine, and we have a measure, a way, we have molecular tests that we can use, we have technology, etc. I think we need to use these, and I think the way, without planning it, but the way we were developing this WISH strategy, Nimmi, I think we were visionaries. We were looking far away, and we were thinking about how health should be. How can we give the answers in the hands of the people so they could take care of their own health? So we will strengthen this concept of public health in which people are responsible of their health, and we could use technology to link them to health services, and we can help health services to be less busy because they will be seeing exactly what they need to see, but the rest could be taken care at the distance. So, I mean, without planning it, I think the model is a model that can help perfectly this new situation. It could be an example for other diseases and other situations that will come. I mean, definitely what we have learned is critical. We will need to promote social distancing, and technology can help with us without leaving health with no answers. I mean, it's we can do this with technology and have the kind of health services that we need.
That's wonderful. And actually, I have to say two things. One is this is a historical moment, undoubtedly. And second, it's likely not going to go away in the sense that there's no guarantee that we're not going to have another pandemic of a different kind or COVID-19 coming back. So we have to prepare for this potentially occurring again in the foreseeable future. But
Absolutely.
the second thing I wanted to point out when you're talking about cervical cancer, just to remind people that cervical cancer kills more than 300,000 women a year. Just now, maybe we can put that number in perspective when we think about the number of COVID deaths globally, right? I mean, you could almost say it's comparable. We don't know what the trajectory is, but it's comparable, and it should remind us whether those deaths are acute or long-term. This is what's happening globally, and we should make those connections and understand that as we solve one acute problem, we need to look broadly at what's happening to cervical cancer mortality globally as well. So I just want to, close by saying thank you. This was amazing, and I always learn so much from you. And I wish you luck with the healthcare changes in Peru that hopefully are forthcoming. And I have to say, you're in lockdown. We're not officially in lockdown. I guess you could call it officially. We're expected to essentially stay at home, and we've been staying at home for the last month too. And it's especially nice to be able to socially connect in the ways that we are and exchange knowledge and information and share that with the broader community, perhaps in ways that we may not have done before if we didn't have these circumstances. So there are many silver linings on the cloud, so to speak. So thank you, Patty. It was great talking to you. And to everyone, I just want to share that we would love to get questions that we can answer. So please let us know if you have any thoughts or questions that we can either share or respond to. So thank you again, Patty, and have a great week.
Thank you so much.
Bye.
Okay, bye-bye.